Welcome to another episode of Boomer Health at Home, the show where we try and provide you and your loved ones information to live a happy and healthy life. I'm your host, Brett Pulte, and these days there are so many different ways to stay healthy. You hear them all the time, and it's important for us to know all of our options. So to help guide us through some of these options, we have with us today registered nurse Jennifer Hicks, and Jennifer's going to help us figure out some ways that we can stay healthy. So, thank you for joining us, Jennifer.
I'm happy to be here. Thanks, Brett.
You've joined us before, but can you give us just a little refresher of your credentials and experience in the nursing field?
Sure. So I am a registered nurse. I've been a nurse since 2001. I worked initially in the hospital, in the emergency room is where I started, and then I moved to surgery, orthopedic and neurosurgery, and then outpatient surgery, and then home care. I've been in home care for the last 5 years.
Okay, good. So you've seen just about everything.
Yes.
So our topic today is integrative medicine. Can you explain to us what that actually means?
Sure. So we have something called allopathic or traditional medicine, which is what we know, which would be Beaumont Hospital, Henry Ford Hospital, and then we have integrated. We have alternative medicine, which sometimes people would categorize that as acupuncture, Ayurvedic medicine, massage. And then we have integrative medicine, which brings both the what's considered alternative medicine with conventional medicine, and the two of them work together.
Gotcha. Okay. So, you said there's alternative medicine. What classifies a treatment as alternative medicine?
Something that is not mainstream or conventional.
Okay.
And it's actually, I think alternative is starting to be an older word because they're saying it's an alternative to conventional. So I guess people would say it's another choice.
Yeah.
But now integrative medicine seems to be combining both, so that it doesn't have to be either or.
Okay. And then, before we came on here, we were talking about different medications that our loved ones had taken, and it seems like there's always a combination of the two.
Right.
Yeah, and it's interesting to see. So, we hear different terms about the types of medicine. So, is there a difference between complementary medicine and alternative medicine?
So, that's interesting. So when I was researching this, it was saying complementary was something to be in assistance to traditional or not. Conventional,
yes.
Because traditional can be Chinese or Ayurvedic medicine.
It all means wherever you grew up or whatever's traditional to you.
Exactly.
Yeah.
Yes. Exactly. Right.
Yeah.
So the complementary is in addition to conventional.
Okay.
Generally, that's how it's used, and then alternative again is something other than conventional, which it doesn't have to be either or. And the good news is that they're both being combined.
Okay, good.
Which is the integrative.
Good. So things do work in conjunction with each other. We don't just you can only go this path or only go this path.
Right. It's never a good idea. Extremes.
Yeah. That's good.
Right.
That's good, especially like we were saying, our loved ones are all doing a little bit of everything.
Right.
And it's nice to see these days that people are opening their minds to new things.
It is.
Yeah.
It is.
Yep. So when you go to a traditional hospital, is integrative medicine really being promoted now, or are they still staying more towards the conventional?
I'm going to say, thank God I haven't been in the hospital in a long time. But I think it's starting to slowly seep into the hospitals. So I know that Beaumont has an integrative department. I know Henry Ford does.
Yeah.
The wonderful thing is there's many more physicians who are combining the two. So your primary care physician may be combining both, which I think is really helpful and can help people. I think would help the masses.
Yeah.
Right? And oftentimes we go to the hospital when there's an extreme. Although if it's surgery that we've chosen, sometimes the surgeon will have the patient do alternative therapies or be taking some sort of a supplement prior to the surgery.
Yeah.
So sometimes that's being incorporated as well.
Yeah, and you know, I as my wife was going through her pregnancy, she had, rather than, you know, just your conventional, here's your vitamins that you have to take, there were different vitamins and different supplements that were pushed in there for her.
Right. Yes.
And it's like you said, it's more the physicians now
Yes.
are doing this.
Right. And then they know their patient.
Exactly. Yeah.
Yes.
That's always go to the person who knows you.
That's right. That's right. That's right.
So, what are some common misunderstandings about integrative medicine?
I think sometimes people think it's quackery.
Yeah.
Also, that it can completely replace conventional medicine, which is, as again what I said, I think when things are extreme either way, because I know you and I have spoken before, all the conventional choices had been utilized in certain aspects of your wife's care, so she then went to look at alternatives or functional medicine, and the great thing is it's not an either or.
Yeah.
Right, so we need both of them, really. We need both of them.
Yeah.
And it's up to the person, I think, to choose what's working for them. Ultimately, we are responsible for our own health.
Yep.
Right.
Yep. So, and that's interesting. You say, you know, you're responsible for your own health. So, do you think people kind of need to open up a little more and try new things?
I think if they are feeling that they've reached the end and their needs aren't being met, particularly with pain is chronic pain is horrible, and so we know that with the opioid epidemic, that even though these patients are taking very strong medications, they still experience the pain. So then I do think, yes, there's alternatives. So that would be meditation, yoga, acupuncture. You and I were discussing the CBD oils.
Yeah.
Those do not make a person's cognitive behaviors change.
Yeah.
They just help reduce the pain.
Yeah. And that's good. And you know, what are some of the biggest changes in the general health of today's population compared to previous generations?
The biggest changes?
Yeah.
Well, we have a lot of autoimmune problems, which we didn't have that I can remember, and maybe they weren't diagnosed, but I think that we do have many more autoimmune problems, and we have problems with inflammation, and we're realizing how that affects the body and the human being.
Yeah.
So I think that is something we didn't have before, and all of these allergies.
Yeah, it seems like everyone's allergic to just about everything these days.
Right. I know. I myself.
Yeah.
Yes.
Yeah. Thankfully, I'm only allergic to penicillin that I know of. No bee stings, no foods, nothing. So I consider myself a lucky one.
Yes, I agree. I agree with you.
So for someone who's only familiar with conventional medicine, why do you think people are so interested in the alternative options?
I think because there are times when conventional medicine did not have answers for us. The other thing too is what I'm stating as conventional medicine, even within its own scientific studies, because we're always trying to help people get healthy or cure a disease, it has brought them, the conventional, out into what was considered traditional, or to study those medicines or to study those theories and see how they're working. Now we have stem cell, which I'm not all that familiar with, but I keep getting bombarded with that information.
Yeah.
And then we have light therapies, and so science is seeing that color therapies really do impact people.
Yeah.
So I think and then we have the nano medications or therapies.
Yeah.
So it's just exploding.
Yeah, and it's like you're saying, there's always studies being done. I actually just came across an old advertisement from the 40s when I was playing around online the other night, and it was for cigarettes. And it was saying that smoke cigarettes while pregnant, you'll have a smaller baby, easier pregnancy.
Oh my God. Oh my God.
I looked at my wife, I go, can you believe this? It's crazy because now we know all the harms behind smoking and while pregnant too.
Right, and see, that just shows you ignorance.
Yeah.
Right, that's a general population of ignorance.
Yeah.
Which to me, that's a great example because it shows you that was the consensus at the time. And wouldn't it be great to have a smaller baby? And right, easier labor.
Exactly. Yeah.
Right.
So we see a lot about essential oils these days, and I know this is something you're into. How do they work, and what are some of the benefits of them?
So, people use them for healing. Actually, there are some that are food grade, so you can put them in your drink.
Oh, wow.
So like a lemon or a grapefruit.
Yeah.
So the different smells, they help us with our emotions. I think that there's a lot that we don't understand how they work. But for example, grapefruit, the smell of grapefruit helps lift a person's mood. If you think of peppermint. They say peppermint is good for digestion, but actually it all depends on the individual, and it can cause almost like a acid reflux if you have too much peppermint.
Yeah.
So it really, again, it depends on the individuals. But let's look at Vicks, which has been around forever.
Yep.
That has in it camphor, if I'm not mistaken, or eucalyptus or something. So we know that it helps open up the bronchioles.
Okay.
The great thing about essential oils, though, is you do want to go with one that is a food grade, because sometimes there are synthetics, which can have they can actually make a person have a negative reaction.
Oh, wow.
Because they're more of a chemical.
Yeah.
But the one thing I want to caution everyone is, I did learn this the hard way, essential oils are not bad for you, but it's not a good idea to put them on and then go lay out in the sun, because you can get burned. Particularly, I think it was citrus, which I love citrus, so I put it on me. So you can get burned.
Wow.
But so once again, we just have to be knowledgeable.
Yeah, and I know my wife uses essential oils quite a bit, and I think it is peppermint or one of the mints when she's having a headache.
Yes, peppermint. It does. Rubbing it on the temples helps to relieve the tension. It does.
Yeah, she has it in a little rollerball jar and rubs it on and lays down for a little bit, and she's good to go.
Isn't that great?
It's for a person who's kind of, I've always been, science. It's kind of cool to see, things. I don't understand how it works, but I can see that it works.
Right. And actually, that's the thing too, which I was saying, is science is showing that these things are working. The other thing I would like to say to the population is, I swear, you can find a positive and a negative, or something is going to say, do this, don't do that. And I just heard about fats. For example, that I guess there's a study that's saying non-fat milk is not good for you. You should actually have the fat. You need the fat. So just like you were saying about the cigarettes. Exactly.
Yeah, and that's very interesting about all the different studies out there now. So what would you recommend to someone who's looking to kind of switch to alternative treatments? Okay,
so I could say ultimately talk with your primary care physician, but if your primary care physician isn't interested in anything like that, you could go to your community center. I noticed that libraries are fantastic.
Yeah.
I tend to think, so I went online for the Mayo Clinic. There is a functional medicine, the director of the functional medicine there is having a seminar on the brain health.
Okay.
Go to a bookstore, walk around a bookstore. You can get a lot of good information. Senior centers, talk with friends who maybe are seeing someone who's seeing alternative or just integrative, really, and functional medicine.
Yeah.
And I do think that it is affordable. I find sometimes it can be so expensive when you start going into the
Yeah.
integrative or functional. So look around and price shop.
Yeah, and like I've been saying, my wife uses some of these, and we've taken the approach of they are a bit more expensive, but it's your health.
Right, that's
You
true
know?
too. That is true too. And sometimes when I've been in a situation where I've had maybe 6 different supplements I've been told to take, I'll say choose the top 3 that are going to help me.
Yeah, yeah,
Right.
yep, and that's really good information. So, Jennifer, that's all the time we have here today,
Great.
but I want to thank you again for joining us. Every time you're on, you give us incredible information.
Thank you. It's my pleasure.
No, thank you. So, and you at home, if you have any questions about today's topics, please give us a call at 248-288-2270 or drop us a line at boomerhealth@americamedical.com. Have a great day.